welcome Academician Yiling. Academician Yiling is the Academician of the Chinese Academy of Engineering, the famous expert on cardiovascular disease in Chinese medicine, and founder and the academic leader of the collateral disease in Chinese medicine. Directors of the State Key Lab of Collateral Disease Research on Innovation of Traditional Chinese Medicine, Deputy Directors of the Expert Committee of the National Center for Cardiovascular Disease, members of the Chinese Academy of Medicine Science, Honorable Vice President of China Association of TCM. And he's also the Vice President of the World Federation of Traditional Chinese Medicine Associations. And now let's welcome Academician Yiling. Hello everyone. The topic of my report is collateral theoretical guidance. Research on preventions and treatments of respiration infectious disease. COVID-19 is raging across the world, threatening humans' lives and health. It reminds us of the pandemic in the last century, with the toll of 50 million to 100 million. In fact, TCM has realized the harm of infectious disease to humans over 2,000 years ago, during the warring state period of China. In the book of Huangdi Neijing, it points out the infectiousness of this kind of epidemic disease. In the Han Dynasty, the treatise on febrile disease by Zhang Zhongjing, the Xinzhuang differentiation of the 6 meridians, includes how to prevent and treat this kind of disease. In the preface of the book, he wrote there are 600 members in his family. In 10 years, 2/3 of the members died. That was because of the pandemic. And then he made up his mind to write a book of a treatise on febrile disease. Since then, such kind of pandemic never happened in China. We can say that the TCM plays an important role in it. In the Ming Dynasty, Wu Youke wrote the theories of the plague, especially discussed the treatments of plague. In Qing Dynasty, Ye Tianshi set up the dialectics of Wei Qing Can blood Xinzhuang differentiation and come up with the famous prescriptions of Lingqiao powder and others. So the theories and treatment left over the 2,000 years have provided a rich experience for us to overcome the flu and COVID-19. Of course, our research is collateral disease, but we're not the one who came up with the concept. In Huangdi Neijing, it already mentioned the concept of branches of channels and collateral disease. Generally, the ancient Asians observed the disease from the clinical point of view, from the chronic disease and long pain transforming to collaterals, which is recurring illness, include cardiovascular disease, diabetes, cancer, and rheumatism. They regard them as collateral disease, while to the invasions of collateral vessels by primary infection includes exogenous febrile disease, the SARS, and COVID-19, which will cause the organ injury. Although the Asians attached importance to the theories, none of them was found into any theoretical system. Between 1979 and 1982, I was exposed to the subjects as a graduate student in Nanjing. At that time, I saw the sayings of 2 doctors. Quote, "The previous sage have detailed the 12 meridians, but not the collaterals. I have read all the medicine, but there was no mention of collateral disease. Doctors don't know how to cure collateral disease. The more we study, the more we need to learn." Quote, "What we 2 doctors say is valuable to the clinic, but the fact is that it didn't develop. So over the 40 years, we studied the collateral disease. With the efforts with the national expert, we have built the collateral's theoretical system, including collateral disease treatment, vein theory, T collateral theory, which laid the theoretical foundation for the setup of TCM collateral subject, and is listed in the National Intangible Cultural Heritage. Actually, TCM has a profound understanding of lung and the respiratory disease. When we see the ancient dissection, you know, the part of the lung includes nose, throat, lung tubes, airway, and alveoli. The TCM calls it the lung system, which is the same as modern medicine. So what are the two main functions of the lung? Lung controls the breathing, and all the veins connect with the lung. In turn, the lung will adjust the flow of the blood. The ancient summarize its air change and blood transformation, and is of great guiding significance for us to discuss the respiratory disease treatment. Thus, we uncovered the occurrence regularity of lung disease. The earlier Qi collaterals, the disorder of neuroimmune function, the disorder of Qi collaterals, and the inventions of exogenous pathogenic factors caused airway lesion. Acute and chronic bronchitis and affected the blood network vessel, PHA and PhD, and so on. In 2003, during the SARS, we first came up with the collateral treatment for internal infection by the use of collateral theoresis. The syndrome differentiation of the 6 meridians involves into collateral treatment. The earlier symptoms are in the young collaterals, then the vein in the medium term. At last, the SARS patients won't show any symptoms of three, but it will cause the damages of collaterals in the lung directly, and then it will die of lung failure. Based on this understanding, we adopted the replical strategy for active intervention. Based on this strategy, we combined Ma Xing Shi Gan decoction from Han Dynasty, Yingqiao powder from Qing Dynasty, and also the experience for the plague from Ming Dynasty and the rhodiola rosta in one prescription. At that time, because of its significant inhibition to SARS through the green channel of the Administration of Science and Technology, it entered the drug evaluation and obtained new drug certificates. After that, it works on the influenza A virus and COVID-19. Besides, also have the effect of antibacterial, anti-inflammatory, anti-febrile, cough, and phlegm. The lab of Zhong Nanshan proves that Lianhua Wenqing capsule can inhibit the influenza A virus, H3N2, and alleviate lung inflammation. And some of the Chinese academic of science prove that it also can hidden H1N1 and relieve lung inflammation. At the same time, Beijing Yuan Hospital took the lead to carry randomized double-blind and multicenter research in 9 grade A class 3 hospitals. It proved that in spite of virus turning to negative, its effect is equal to delta, but to the abatements of fever, cough, sore throat, and lack of strength, is evidently benefit than Tamiflu. This time, Lianhua Qingwen played an active role in the prevention and cure of COVID-19. In the first quarter, during the earlier outbreak, 70 million to 80 million Chinese took the 莲花清瘟 capsules. And 3. Academician labs test its effect on viruses and found its antiviral and anti-inflammatory. And some of the Institute of Pharmacology performed experiments on the COVID-19 affected big mouse and proved that it can reduce the lung damage of the mouse significantly. And Academician Zhong Nanshan, Academician Li Lanjuan, and Academician Zhang Boli hosted the cure of 莲花清瘟 on COVID-19 multi-center clinical research. This medicine can improve the disappearance rate of clinical symptoms, shorten the time of duration, improve the negative rate, the cure rate and the CT rate, and reduce the severe cases. This paper has been published in an international magazine. So far, since 2005, the MHC and MATCM have recommended this medicine for 20 times to cure H1N1, influenza B, Ebola, MERS, and COVID-19. This medicine not only plays an active role in China to deal with the pandemic, but also in more than 20 countries with the registration and marketing authorization. At the same time, in America, the phase 2 clinical trial of this medicine has finished and is about to move to phase 3. During the pandemic, we developed a compound TCM 莲花清科 tablet to release the lung heat, relieve phlegm, and relieve cough. For acute bronchitis, we performed a randomized double-blind and multi-center clinical trial and proved that it can reduce the cough rate without any drug-related adverse reaction that inhibit the COVID-19 and the lung damage of the COVID-19 infected mouse. The RCT of 莲花清科 tablet to cure COVID-19 has proved that it can reduce the cough rate. As we know, the main causes of the COVID-19 patients changing from mild symptoms to severe symptoms is that the bronchs and alveoli are filled with the sticky secretion. TCM's resolving phlegm and relieving cough works well on these problems. Our research proved that it can reduce the secretion, dilute the sputum, and help the patient to spit it out, and then improve the breathing function. Based on this, we proposed the treatment to treat the COVID-19 with antipyretic and detoxification and resolving phlegm and relieving cough. Then we put forward a comprehensive treatment to prevent the invasions of the virus. We used the plant fiber of 莲花清瘟 to produce must. The experiment proved that its virus killing rate of this must is up to 99%. And we also used extract of this medicine to produce indoor air freshener and disinfectants to nurse the inner body. We focus on 2 physical symptoms. One is the lung heat, and we develop 莲花 drinks to clear away the heat in the lung. Another one is for the weak patient who have many chronic diseases, low immunity, and easy to catch a cold. We developed 莲花玉萍 granule to improve physical fitness and immunity and reduce the chance of catching illness. So the collateral theories is the precious legacy that our ancestors left for us. It not only has a significant value to guide the clinic of major disease like heart and brain, but also play a positive role in the treatment of flu, SARS, and COVID-19. It's worth of depth research and will help the collateral theories and 莲花清瘟, 莲花清科, and other theories of healthy products benefit the Chinese and all the humankind. Thank you.